men's health continues to get neglected, partly because men being busy, men posing to be busy with everything other than their own health, sometimes they miss out on that important aspect of a progressive change. So men's health, which also has a connotation to andrology or the sexual health and the urinary health, is progressively changing. And therefore, it's responsibility of each one of us as men to be able to take that health also balanced. Because it brings about a lot of anxiety and a lot of difficulties little later on, just when we cross the bridge and understand that we are patients to doctors who are urologists, who are andrologists. And that was very important for us to understand that urinary health and sexual health is changing. For a short while, or the next few minutes, if I want to talk about andrology or men's sexual health, and two very common problems which are absolutely hidden and where people cannot really come up and speak to their partners, peers, their friends, and also their doctors and urologists in their locations. One of them is called erectile dysfunction. Just not an erectile dysfunction, which is so psychological and anxiety related, but frankly speaking, erectile dysfunction, which we're seeing in modern age in 2023, are those diabetics who are 10 years plus into diabetes, number one. Number two, those people who have been smokers for a long time. Those people who have got neurological diseases, which don't allow the regulation of normal functions or the neurobiology of changes which is brought about by erectile function. So if your neurophysiology of the endocrine system, the hormones, your blood supply to the pelvis, and finally your entire neurological aspect is good, then probably your erections are normal. So if we ask about, do you have good early morning erections, and you say my erections are good in the morning when you get up and you have a good, tight, rigid erection, then I think the entire aspect of neurology, the blood supply and the hormones are all in sync. But this gradually changes. People know that this changes also with anxiety, changes also with absence of regeneration or sleep. And it necessarily changes when you go through a progressive organic diseases. And those diseases which I'm talking today about are uncontrolled and long-standing diabetes, number one. Number two, being a smoker. And number three, all neurological diseases. You may relate it as Parkinsonism, spinal diseases, injuries, trauma, pelvis, fractures, name it. All those things which have got neurological and which have got vascular issues around, including sometimes patients who are on antihypertensives. Long-standing antihypertensives as a medicine itself can have an effect. It only contributes, but does not really be causal. So if there is a cause of erectile dysfunction, which is progressive, where you are failing medications and the pill that you take either off the counter or your urologist, andrologist gives you, and when you see us at the Kokla Dhirubhai Ambani Hospital, we look forward to, do we label you as somebody who can be treated with medicines, with all that which can do medical, or sadly you are a refractory erectile dysfunction, which can happen to people in very young age, middle age, and obviously elderly because of progression of change. So all who are diabetics for more than 10 years, all who have got neurological issues, all who had a trauma, all who have got spinal issues and brain issues, and those patients who have undergone surgeries in the pelvis, whose blood supplies have been on the lower side, and sadly you've been a smoker for a decade or more, there's a high possibility that there could be changes happening which are irreversible in the organ called the penis. Refractory erectile dysfunction. Refractory erectile dysfunction is treatable, is curable. So why wait? And I get to see patients in scores coming in various locations around, and they come in with hope. They come in obviously with agony and a lot of disgust and probably expectations around. And therefore, to match those expectations, we got to identify them, evaluate them, look at their changes happening around, and bring their erectile function normal, close to normal, improve it progressively up the ladder. For that, there are obviously medication. There are obviously interplay of changes which you bring about to bring about the hormones, the neurological activity, and the blood supply. But as I told you, all the three, they can't be reversed. They can be reversed on the paper in terms of bringing about changes, and your diabetes can be now brought well under sugar control. But how does that bring about a reversibility of progression which has happened around? Once your black hairs turn gray, they cannot turn black anymore. You have to paint it. In other words, changes which are progressive need to be known. And therefore, men who are diabetics and men who are smokers, my sincere suggestions to always to them is your urinary and sexual health will progressively change. Please be awake to that and maintain it as much as possible, because you cannot really change your body. The body's organs also cannot be changed. And therefore, this challenge will always stay. It's important, therefore, for us to look into the aspect of care where we will look at our diabetes control very, very strictly, where we look at quality of life improvement by physical health and exercises and the diet that actually goes in and brings about changes, and those toxic byproducts called the excretory products are removed around. So be very careful of what you eat, what you drink, what you speak, and obviously all those changes are progressive. So friends, diabetics, friends who are smokers, and all those who are in their 40s, 50s, and 60s, a age-related progression is happening, and these progressions can bring about a refractory erectile dysfunction, something where we look forward to treating and curing you. And one of the ways to treat and cure is, frankly, to look at reversing you completely. If I look at that aspect and I look at curing you, then I also look at there is therapy available where we look at erectile dysfunction managed with malleable processes. That's Shah's malleable processes, something which we implant into the shaft of penis. A pair of that is implanted into the corporal bodies where the blood supply is not happening. The neurological process has decayed your erections, and erections are going down. So in neurology, I see a lot of patients who come with progressive, refractory, organic erectile dysfunction, which is not reversing. So that's a very versatile kind of malleable thing which goes inside your body, but it never lets you grow old anymore. You are now a capable man who will never grow old because the organs are actually made stiff and they can be bent, they can be hidden, they can be concealed. So a very versatile Indian processes designed by Dr. Rupin Shah, which actually has done rounds across on various requirements, which includes, for me, even a post-phalloplasty patient, for patients who have got refractory erectile dysfunction, patients who have had injuries, pelvic fractures, stricture urethra, major accidents around, and neurological aspects, including spinal diseases, जहाँ इरेक्शन बिल्कुल खत्म हो चुकी है और वापस नहीं लौट रही है या वो capable नहीं है. We have used this for over last 2.5 decades, and this has been very, very effective. So Shah's Indian processes acceptable to many individuals because of the cost factors, which is what has helped them out. But when we look at the versatility and the progression of various changes happening around, we today have got malleable processes from the outer world, from the South American group, from the North American group. You've got various wonderful processes which are available. That's another one which actually look at the rigidity of this. So that is implanted into the shaft of penis. And as this goes inside, you're never an old man again. You're never old between your thighs because you have a capability of consistent, capable erections, which never ditches you. And you can always hide it around. And these are researched over 10 to 20 years. That means for 25 years, these will be capable kind of an organ. So these give you that capability of turgidity, of rigidity, of demiscence, all that you were waiting for, where your pills did not work. So that was one aspect of andrology, of men's health or men's sexual health, which is fast progressing for people 40s, 50s, 60s, especially with comorbidities. Smokers, diabetics, spinal issues, nerve injuries, accidents, etc. They sadly have more. We also have obese people, very fat people, who actually cannot find their organ. Their organ is very much there, but there's so much of pannus of fat, so much of prepubic fat, so much of fat in the inguinal that when they want to pass urine, they really can't find their organ around. And that gave me an indication to look at, can they find their organ if they make it a little rigid, make it a little capable, and make it visible to them, at least finger visible and hand visible, because they cannot feel their tummy around. And for them, many a times, we did implant the processes into their organ. So the organ can be felt, they can direct the urinary stream rather than getting wet every time they pass urine because they are fat and they are really obese, and this can't be reversed even by bariatric surgery. So I'm seeing indications right now in 2023 for erectile dysfunction reversal by using the malleable processes, and these are extremely effective. Look at it, that I can bend it around, conceal it. So these have got the kind of rigidity that you aim, they've got the concealability which you always want to be concealed. And finally, at the end of it, you are capable enough and capable forever. Friends, while I look into this, erectile function also changes in another disease, which is actually doing rounds around. And I get to see few every week and multiples every month from all over the country, either in acute phase, disease just started, or in a progress phase and stable phase where we need to now forget the treatment, bring about the cure. And I'm talking about something called as Peyronie's disease. Peyronie's Francois Peyronie, who actually defined a disease process, which for the sake of signatures and spelling is called Peyronie's. And what do men complain of? Men complain of everything out here. Their organ shrinking gradually. They are not finding the erections anymore straight. The erections are painful. And why? Even the non-erect shaft is painful. They're looking at all these changes happening where there is a curvature in the organ is getting more difficult to stay erect, and therefore the postures adopted by the partners is only getting more difficult. So pain, a plaque which is palpable to them and palpable to us more, gives us an idea about what could be happening. And that's Peyronie's disease for you. So Peyronie's disease is a progressive change happening in the shaft of men in their mature years through no fault of theirs. It's believed to be an immunological disorder, believed to be an autoimmune disorder going to be a micro trauma happening where a plaque or a small nodule develops in that area, which is just underneath the neurological angle, which means there are layers of the penis, the skin, and thereafter underneath is the neurovascular bundle, and underneath the bundle is the tunica and the buccal fascia. That's where the turgidity comes from, because that holds the rigidity of the internal organ called the corporal bodies that the blood supply flows in. And if that is the area where a plaque develops on the wall, the thing can actually, if there's a plaque developing here, it can start bending gradually. And the bends are not capable enough. Many of them have a dorsal bend towards themselves, and around 10% people come with a ventral bend or a bend downstairs. And I get to see them. I see the pictures first. So they always come in when they see me on the YouTube channel. They actually come up with the pictures of the best erection. Sadly, the better the erection, worse the curvature. The best the erection, worst his curvature, which is his incapability is worsening with passing time. The more trouble with him progressively. Many of them actually have got plaques which are painful. Many of them they come in acute stage where we want to deviate the natural history, but natural history of the disease cannot be deviated. In other words, we're going to look at individuals who can be corrected and cured. As numbers soar in this aspect of care, more and more people are needy, and sadly, it's not discussed much. As urologists, while we are so much busy with urinary health, with obviously changes happening in the genotoxicity of aspects happening, and we're seeing so many cancers around, we're seeing a lot of things happening. So while it all keeps you busy as a urologist, there's an andrologist deep inside us. Many of us have trained and gone into it. We look at penile processes, we look at Peyronie's disease, we look at varicocelectomy, and you saw all of them there. The penile process is the varicocelectomy. And so that's how the wall fills up with more and more people coming in for cure with expectations, and they actually get treated. I think it's time that men's health does not get ignored. Obviously, the urinary health should never be ignored, because that gets ignored both in men and women, because it's a very progressive change. It doesn't happen in an hour, in a day, in a week, in a month, in a year. It's all progression over decades. By the time you wake up, you actually have come to the edge. And from there, when you slip, you demand a cure. So it's nice to be aware of that. Awareness is what you need to bring to the front row seat. So men's health is completely in the grasp of a urologist, of an andrologist in your city. Whichever city you are in, colleagues in urology and andrology are doing awesome job in their locations around, and I think we all form a team. We get to see few of them who come from various cities to Mumbai, treated and cured, and probably have more expectations, and therefore we keep discussing with them. But many of us meet us at the Kokilaben Hospital and Department of Urology, where we look at penile processes for refractory erectile dysfunction and curing them, where we look forward to Peyronie's disease and bring about a passion towards permanent cure by straightening the organ and giving them back the erection. So shrinkage of an organ, bending of an organ, pain of the organ, which is making you less and less capable in the bed, can all be treated and cured. It's time to wake up to this phenomena and probably see your urologist, your andrologist. Don't live with the agony of Peyronie's disease. Don't live with an agony of painful, incapable erections, which actually is worsening you. Friends, it's important to get this awareness drive right into heads of people who are needy and suffering, and many a times they get to see this and probably come over. I think it's important that these awareness drives reach the society and they get well into locations where they live in, with our colleagues treating you in your cities. Thank you so much.